live and then you unmute. Sorry, mute.
Live.
Okay, good evening, everybody. Today is another important day for us, a nice weekend. We are looking at 112th day of continuous integrative medicine education series. And today we are joined by the past president of IAYT, International Association of Yoga Therapy, Professor Dilip Sarkar, who's an MD and FACS, CIAYT, D.Litt Yoga, and he's also the chairman of the Center for Integrative Medicine and Yoga at Taksha Institute, Hampton, in the state of Virginia in US. So he's joining us from the United States. He's a retired vascular surgeon turned yoga acharya. So that's very rare. And you're here for a feast to understand what he has to say and to know the things, the science behind yoga in Western terminology. I guess that is what is coming your way. He retired as an associate professor of surgery at the Eastern Virginia Medical School, Norfolk, Virginia. And now you know what he does. He teaches yoga therapy, Ayurvedic philosophy, and Ayurvedic yoga therapy, both nationally and now internationally because of the digital interface we all enjoy. So he's very digital friendly. He was telling that from hundreds of conferences, he has moved to 1,000 thanks to the lockdown blessing in the form of Zoom and all the Facebook lives. And he's very good at it. He's also on my Facebook friend. I keep seeing him. It took me some time to say get a yes from him. He's been so kind and humble. Although we'd had some meetings in Goa, in Svyasa, but I'm so happy to welcome him to this interface, which brings him live to about 10,335 as of now subscribers, all of you, which includes HCWs, yoga academics, biologists, physicians, policymakers, and about, my guess is 20 to 25% of international viewers. So Dr. Sarkar is here with us, and I would like to just name a few of many awards and positions he had held. He's been chairman of the board, Life in Yoga Institute, life member of National Ayurvedic Medical Association, fellow of American College of Surgeons, and fellow of American Association of Integrative Medicine. And during a convocation, he was even awarded Doctor of Letters, as I mentioned right in the beginning, at the world's largest yoga university, Svyasa, which he was just mentioning in our personal conversation that has now gone international. Svyasa has a Vayu campus in California. And you know what? His new DVD, Yoga Therapy for Health and Healing, a daily practice, and his book, Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence, was published in 2017 and became quite popular. So you may like to lay your hands on that book. But before we go to the books and we hear more about him from me, why don't we let him speak directly to you? And I have requested that in the interest of our viewers, he may consider giving us a few exercises, asanas, and maybe meditation if he's in good mood. Over to you, Dr.
Yes.
Sarkar.
Okay. Thank you. It's a good morning from America and good evening from India. We have been interacting, Akshay and me, for a long time. And I've been following him, he's been following me. And this is the positive side of coronavirus. Now we are all connected internationally, globally. And the same issue, the diabetes, which is killing most of the not Indians and all over the world. And he asked me to, from the yoga scholar standpoint, the integrative approach. And my book, which I'm going to show you a little later, then I'm going to have to go and get it from a library. The name of the book is called Yoga Therapy, Ayurveda and Western Medicine, called Your Healthy Convergence. Now, before I start, let me just introduce a little bit. What is the state of integrative medicine in America? The integrative medicine today in America is regarded as an integration of the wisdom of yoga therapy with the science of modern medicine. As I said, when a science stops, philosophy begins, wisdom begins. And about, say, I'll say 15, 18 years back, we have about maybe 3 or 4 medical school, we call it medical school here instead of college and institute. Out of 140 medical schools in the United States had a department of integrative medicine. Today, we have almost about over 100 medical schools who has a department of integrative medicine. About 65 of them has a fellowship program. That means after finishing your internal medicine, like in India, what you have a MD in medicine, you get a subspecialty, like your DM, subspecialty like a integrative medicine. 25 programs have their full fellowship training towards the, call it board certification. Like the exam you take for DM, it's America, it's called a board certification. You finish your medical school. After medical school, you take your internship and residency, then you take the board certification to your specialty, say medicine, surgery, OBGYN, then subspecialty. In 2014, the American Board of Medicine started the American Board of Integrative Medicine. Now it is a board certified specialty, and most of our hospitals, like in America, the first person who really brought the science behind yoga, his name is called Herbert Benson. Herbert Benson was a follower of the transcendental meditation. When the transcendental meditation came to United States, he started taking, and then he felt the physiological effect. His blood pressure is coming down, heart rate is coming down. So he wrote a book at that time. And the book is called The Relaxation Response. And if you look at today, it was almost in 1969. At that time, probably he was skeptic to write the word meditation. So he wrote The Relaxation Response, but the whole book was meditation. He's still there. The institute is in Harvard now. It's called Benson Henry Institute. And now there is integrative medicine all over. Now, let's come, for the sake of time, for the diabetes. I'm going to give you a little bit of what is the concept of integrative medicine in diabetes. Now, what we know from our Western medical experience is that we talk about type 1, type 2 diabetes, it's insulin resistance. But what we have found out that if you give a little small dose of prednisone to a diabetic patient, blood sugar will shoot from, we call it a milligram here, the different, your place in millimole, 150 milligram to 450 milligram, it shoots right away. So what prednisone does, prednisone blocks insulin, and also it helps glycogenolysis from the liver. So blood sugar shoots way, way high up. Guess what? The hormone of stress is cortisol. So the stress is the #1 factor which is going to raise your blood sugar high up. So you need to do the stress management. So what we find in the stress management from the integrative approach is that stress is a sympathetic overdrive. We have a sympathetic overdrive in our body, whatever you call, fear of unknown, but end product is your outcome of sympathetic overdrive, epinephrine, norepinephrine, and you know all about it. Blood pressure goes high up, respiratory rate goes high up. So the practice will be a relaxation response and activation of your parasympathetic tone. And parasympathetic tone will be the activation of the branches of vagus nerve. The vagus nerve is the carrier of your parasympathetic tone. So you will see the practice, which will be very surprised, because when you go and see a diabetic a treatment for yoga therapy, they will show you all the asanas and pranayamas which are geared towards pancreas. But the primary effect you need to do activation of the branches of the vagus nerve. Very, very important concept. So for example, there is a branch in the vagus nerve on the ear. It's called your auricular branch of the vagus nerve. So massaging the ear and massaging, the most primary is in the external ear canal. So, when you give a little bit of massage external ear canal, you get a very comfort. That is a vagus stimulation. You have a branch in here, pharyngeal branch, laryngeal branch. Then you have a cardiac plexus. Then the vagus nerve comes in front. The left comes in the front, right goes to the behind, the gastroesophageal junction. This is anatomy. So when you're able to squeeze the laryngeal plexus, like in a very loose, very relaxed way, you can do a very simple Ujjayi pranayam. When you do Ujjayi pranayam, you are going to keep your spine straight, your eyes closed. I'm going to breathe out first. Take a deep breath in. Completely breathe out. Okay. When you get a cough, it is normal. That means that's where the cough comes from. Now, let me go a little bit further in this Ujjayi pranayam. Like we have a lot of physicians here. It's a postgraduate institute. The larynx is supplied by superior and inferior laryngeal nerve. Superior laryngeal nerve supplies cricothyroid. Inferior laryngeal nerve, which is a branch of the recurrent laryngeal nerve, supplies the other intrinsic muscle of the larynx. In the vagus nerve, 80% is it's called afferent. It is going towards your brainstem, and 20% is the efferent. It's coming out. So all the information is going in. When they're coming out through a hypoglossal nerve, glossopharyngeal nerve. And then you can see that if we incorporate, most of you are I guess, you are knowing all the yogic practices. So if we incorporate a chin lock, Jalandhar Bandha. Jalandhar Bandha massages the carotid sinus. Carotid sinus is on both sides at the bifurcation of the carotid artery. So when you massage the carotid sinus, it creates a profound relaxation response. Like for example, when you get a supraventricular tachycardia. In supraventricular tachycardia, we do a massage of the carotid sinus. Then think about the other concept of diabetes from our integrative approach is that the body cannot digest sugar, as simple as it is. So our digestive fire from yogic and Ayurvedic concept is called the agni, jathar agni. Agni, in our Western term, we call it a proper perfusion, proper innervation, proper functioning of an organ. So for the agni, if you jathar agni, the practice we use, primarily we sit down in the Vajrasana, thunderbolt. What happened in the Vajrasana, when you sit in a Vajrasana, it activates your parasympathetic tongue. And as you know, very, very simply, the parasympathetic is called calm and digest. Sympathetic is called flight and fight response, calm and digest. So all the digestion, if you see from your salivary glands all the way up to your anal sphincter, is supplied by parasympathetic nerve. So what happens when I practice a yogic relaxation, when I'm meditating, when I'm very gentle, simple pranayama, or I'm holding an asana pose, I'm in a Sukhasana, Siddhasana, Padmasana, First thing I see, I have some saliva in my mouth. What does it mean? When I have a saliva, I'm not drinking any water. Saliva means when you have a sympathetic overdrive, when you're stressed, fearful, you get a dry mouth. So when you get a saliva in your mouth, that means you have parasympathetic activation. So it's called your Udyani Bandh, abdominal lock. When you do Udyani Bandh or you do a Kapalbhati Pranayama, you activate the Jathar Agni. Also, when you sit down, simply in a Vajrasana, and you have seen our forefather, my grandfather, their parents, even my father in India, after a full meal, after lunch or after dinner, they will sit down in a Vajrasana. And Vajrasana, I said, only asana that you sit down with a full stomach. So what you do, and then also the other asanas like a Mondukasana. You put your, both the, we do call it Adhi Mudra. Take the hand, this very, very interesting mudra. I like to call it Balo Mushti Mudra or Adhi Mudra. Take the thumb inside and close. This is a very powerful relaxation. This is the way baby closes their fist. And you put it around here. And if you're in Vajrasana, just you breathe out first, take a deep breath in and slowly come down. And basically, you are activating your Jathar Agni. Now, you can see what will happen. I'm giving you the concepts because these are the most important concepts. Third concept is about integrative approach of diabetes is that in yogic tradition, if you massage an organ, that organ gets more healthier. The organ gets more functional. So anatomically, think about pancreas. Pancreas, which is secreting insulin, pancreas is sitting all the way to my posterior part, all the way to the back, almost close to your vertebral body. So if you keep that concept back of your mind, now any asana, when you do it you manipulate your spine, that is going to affect your pancreas. And in a yoga therapy, what you do, we say yoga therapy is the art of transformation. We use the word called, we transform from a rogi, a patient, called to a nirogi, called a healthy, then you call a yogi. So the way we do it, we really don't push anybody. We said you start where you are. We let them start with the asana and sit down in an asana, any asana, even sitting in a chair. Always keep your spine straight, Merudanda Achal and Manasthir. Next thing we do is called no pain. You come to a position when you are rogi. Don't compare with anybody, don't compete with anybody. Come to a posture where there is no pain. If you have a pain, that means you create an imbalance in your physical body. In yoga, it says that pain means pay attention. Very, very important concept. Do not cross the limit of it. Or also do not do a asana practice or yoga practice after taking some pain medication. Don't take a ibuprofen or acetaminophen, any medication, and do a yoga practice. Next is the yogic concept is Annamaya Kosha to Pranamaya Kosha to Manomaya Kosha, 5 koshas. So any imbalance you create in the physical body, it will show up in your Pranamaya Kosha. What does it mean? So suppose you want to do a spinal twist called Vakrasana. Actually, I have within a half an hour, 45 minutes, I will have a class at 9:30 in a Facebook Live. It will be the therapeutic pranayama and your relaxing asanas. And I'll show it to you, all this. So suppose you're doing Vakrasana. So you're putting your one hand to the back and a leg in the front and slowly twisting your spine. You will see when it started twisting, At certain point, you'll see you catch your breath, that you cannot do any more breath. You stop little short of it. That means your breath has to be completely effortless. If you have no pain and you have an effortless breathing, and that will be your therapeutic asana. And therapeutic asana slowly and slowly progress. And the asana has stages. We call arambho at the beginning. Then you call it sthiti. Sthiti is here when a muscle cannot stay contracted too long, and muscle will start to do, it will do a little twitching, and slowly it completely stabilizes. Finally, it's called your visarjan, profound relaxation of your muscles and ligaments. Remember, all the pain fibers are in the muscles and ligaments. So now, any asana where you are going to do any manipulation of your spine will be going to affect your pancreas. So Yoga Mudra, so your, say Vakrasana, Ardha Matsyendrayanasana. So we could think about this, how to massage the pancreas. So 3 concepts for you to take home is that first, massaging the pancreas by the asanas, and the asanas in a therapeutic, you hold into the poses. You come to a pose where you are comfortable. We call it a comfortable discomfort. And the term we use is called neuroplasticity. Neuroplasticity means we could call it a habit forming. By the time you come here, slowly and slowly, body will know that, so will allow you to go a little bit more. So see what happened. We can do any asana, any practice. You name an asana, I can do it. How it came to me because of my neuroplasticity. I'm sitting in a chair. I'm not sitting. My brain is allowing me to sit because of my neuroplasticity practice, because I've been practicing here. So all the asanas which are massaging your pancreas, spinal, any spinal manipulation will do. I'm sitting in a chair. I'm holding my chair, breathing out first. Always breathe out first. Lung is like a balloon. It has a 4.5 liter vital capacity. You only breathe half a liter. So breathing out first, take a deep breath in, slowly breathe out. I'm just turning my spine, is sitting in a chair. This is a powerful tool for your diabetes because it's massaging your pancreas. Igniting Agni, as I said, Udyani Bandh, abdominal lock, and also Jalandhar Bandh. Then you can do your Kapalbhati Pranayama. So you're massaging, then you can also do Nauli Kriya. So now let me finish with 3 concepts: massaging, Agni Deepana, when you ignite your Agni. And from little bit of Ayurvedic perspective, let me bring it up to you so you will understand a little bit better, is that in an integrative approach, when you have an Agni Deepana, when Agni ignites, it causes Ama Pachana. Ama is the toxin. Ama is the toxin of an undigested food. In yoga and Ayurveda says that when you take a food, the food gets digested into Saptadhatu, Rashadhatu, Raktadhatu, Mansodhatu, Merodhatu, Ostidhatu, Majjadhatu, Shukradhatu. Then it produces a substance called ojas. Ojas your immunity. That ojas gives you your body's ability to fight the disease. So if you didn't get properly, the food is not digested, it produces a toxin called ama. And from Western concept, we said that ama is your high cholesterol, high sugar, anything high in your blood is actually coming from the undigested food called ama pachana. Ama is destroyed. They're called nadi shodhana. All the nadis are open up. Then it's called ojo sthapana. Then you get ojo. Ojo is the one which is going to protect you from all called endogenous disease. Massaging pancreas, igniting Agni, and controlling your sympathetic overdrive. Let me finish with the last practice. So last practice we said that you can do Ujjayi Pranayam. In Ujjayi Pranayam, you are stimulating your vagus nerve through superior and inferior laryngeal branch. During the Ujjayi Pranayam, you are going to do at the same time when you're trying to do your Uddiyani Bandh. Your whole abdomen will be sucked in. And with the Uddiyani Bandh, it increases the negative intra-abdominal pressure. It improves the perfusion of the organs and is also Agni Deepana. Then you incorporate your Jalandhar Bandha. When you touch your chin to the chest, it stimulates your carotid sinus for activation of a parasympathetic tone. At the end, you will do a Chandravedi Pranayam. We're breathing out through your nostril. That will be your calming, cooling, and relaxing. Remember, right nostril breathing is your Surya Nari, sympathetic. Left nostril breathing is your Chandra Nari, parasympathetic. So let me finish. This is a very little advanced practice, but I like to show you the advanced practice because all of you are advanced practitioners. These are yoga scholars. So the first, you will do a very simple Ujjayi Pranayam. The way to do Ujjayi Pranayam, and I always do with my eyes closed. When your eyes closed, I can clearly visualize my body. Breathe out first. Use your Adhi Mudra in your hand. Breathe out first. Take a deep breath in. Completely breathe out. Start a Ujjayi Pranayam. See, Ujjayi Pranayam with your abdominal lock, Uddiyani Bandh. See how to do it here. See how beautiful it is. I'm going to show it to you. Let me stand up. So when you are doing that, you will have enough time now. I'm showing you in stages. This has been the last practice, so we'll have a little time for question and answer.
Yes.
After that, you'll incorporate Jalandhar Bandha and left nostril breathing like this. Sorry, I took much time, but this is my life. I love it. I love this thing. I have to. If you have a time, I have a few minutes.
Yes.
My next class starts at 9:30.
Yeah, we have time for 2-3 questions, rather more of comments. The first one from Sanjay Bhalla saying outstanding explanation. So I really enjoyed that. I agree with him. It was very cool, very smooth, and full of explanation. People who are logical, people who like scientific explanation, they had their treat today. And then Rita.
Just one second. Let me get my book here. So show it to my book and my DVD.
Absolutely. So I hope you all enjoyed Dr. Dilip Sarkar's wonderful explanation. He's, as I may remind you, the former president of International Association of Yoga Therapy. He's an MD, and his topic was on the integrated approach to diabetes, and that's his book that he has written. And he explained to us the integrative medicine as it stands in the United States. That's the book, Yoga Therapy, Ayurveda, and Western Medicine.
Healthy convergence. But one very interesting thing I wanted to see, I put a picture of Albert Einstein and Tagore, Rabindranath Tagore. So see, this is a scientist and a philosopher. I say, when a scientist meets a philosopher, you have the complete cure of the disease. When you are in a science, it's called symptomatic therapy. When the science and philosophy combines, it's called systemic therapy. You are removing the roots. So science is our prednisone, cortisol. Philosophy is our agni. Very simple. Body cannot digest sugar. How much more simple it can be? You know, your agni is low, and then the total concept of the vagal activation, parasympathetic activation. There's also my DVD, which is, these are primarily for the physicians I have done. So,
and Rita Isaac says you would like to hear these comments as a feedback. I'm sure you would like to hear this. Quite appropriate and valuable information shared in this session. Thank you so much, sir. Then there is a comment from Mohinder Kumar Virmani saying, now that yoga is acceptable world over as a encounter science and alternative system of medicine treatment, can we expect establishment of a research center around the globe to re-establish its authenticity, which appears to have been lost because of it being centuries old science and emergence of modern system of medicine, which has started ruling the medical world and are not in favor of any other system being encouraged? Well, here we had Dr. Dilip himself as a so-called Western or conventional MD doctor moving into Ayurveda and yoga. So I think more and more people are moving. He mentioned that the American board now recognizes integrative medicine as a board certified.
Also, one more comment is that when I was the president of International Association of Yoga Therapists, we started the first, it's called a standard accreditation certification process in yoga therapy. Then what we have done since 2010, almost 10 years, we have done a dedicated a conference called Symposium on Yoga Research. This is the only dedicated research conference in the world. I've been to all over the India, you know, every Indian centers. I've been as a guest speaker. We have their national conferences where a part of it in the research. This is for 10 years. Me and there is another researcher from Harvard. Many of you might have known his name. He comes to India quite often. He goes by the name Satbir Khalsa. Satbir Khalsa, this was a dream. And this conference this time was in October, but we have to go to, you know, virtual online now.
Yeah.
So you can Google it, Symposium on Yoga Research, SYR. So to answering the last question is that, yes, we are very proactive. In fact, the thing I said, don't take it other way around. This maybe offend few of you, including myself as the Indian. The best export in the world is yoga, no question about it. But the yoga practice has refined, brought up as a science, and brought up as a therapy. Now, from West, it is also going to East. Even is going to India as a therapeutic product from the West. So we call it East meets West, now West meets East. Hope I didn't offend anybody, actually.
Not at all.
Research is going on. But this Western mind is for research. Western mind has a question. What,
Science
when,
goes,
where, how?
Yes, you're right. And we will search that program that you organized with Satbir Khalsa. In fact, you'll be delighted to know he was part of our program in the first few weeks when we started on the March 21st. He was there on the March last week or something. I propose that we have a global advocacy for integrative medicine. The world leaders come together from the yoga field, physicians, biologists, Nobel laureates, editors of top journals. We are in fact planning one, and I will inform this group, and I will also approach you to have a global advocacy platform where we institute means and measures and milestones, 1, 2, 3 step, how to make it happen with the hospitals. What do you think?
Okay. To answer to that first, our Nagendra ji, H.R. Nagendra ji, which all of you know, has started one which is called the Global Consortium of Yoga Therapists, GCYT. We had the first meeting in 2018 in Japan with the Japan Yoga Therapy Society. So I was there, I was a guest speaker. So now we have the one platform called GCYT. You can Google it and see. Global Consortium of Yoga Therapists, GCYT. Now, I think the way things are moving in, at least in United States and also in European countries, the impact is from bottom high up. Bottom high up means instead of telling somebody or pushing, have integrative medicine, incorporate yoga in your practice, I think it is coming other way around. The whole population who is getting better, like I have not even 100, but thousands and thousands of people who are doing with me, I'm teaching that they have three things. They're off medication, they're enjoying a quality life, they're disease-free, and even person like me, I think I told you, I had a open heart surgery, triple vessel coronary bypass 20 years back, 15 years. I have not touched a single pill. I don't think anybody. So what I'm saying, from bottom high up, it is coming. So, a policy making is good, but more than policy making, it is slowly and slowly climbing, and we are expecting it to be in the top of the top very soon.
You said it very nicely. Bottom-up approach. May I coin it or define it as patient-centered or patient-demanded or patient-driven? That's the way.
Beautiful, beautiful.
Thank you. And
we have. Okay. Sorry to interrupt. We have in my almost almost 55, 60 years of my medical career now, 55 years. What I have seen, a new procedure or anything new idea when it comes, hospitals will reject it, medical school will reject it, but exactly what you said, patient-centered. Patient will come and say, hey, I want a laparoscopic cholecystectomy. Surgeon says, I cannot do it. Okay, I'll go to somebody else. Because when you do open cholecystectomy, it's a 6 weeks downtime. Laparoscopic cholecystectomy, outpatient procedure, I'll be back to work in 3 days. So you're absolutely right. It is totally patient-centered, the new procedures and technique.
Here's another question. I thought that would be the last one. Thank you. Different types of meditation practices and the specific effects on human behavior, transforming our mental, emotional, and spiritual equilibrium. Or he's asking whether different meditative practices have different effects. Does one meditation practice pertain to emotion, another to intellectual, the third to a spiritual aspect? What is your comment on that?
Okay. I did a whole program for Indian Embassy in United States. The first thing was yoga is meditation. So we use the term, even especially in the West, yoga and meditation. Remember, yoga is a philosophy. It's a darshan, Yoga Sutra Patanjali, 196 sutras, and think about, out of 196, 193 is your manasthir, to quiet down your mind. And then if you look at the practice, Patanjali Ashtanga Yoga, Yam, Niyam, Asana, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi, everything goes towards your dhyan, meditation. So my way of looking at meditation is that meditation, that you don't practice meditation. You don't say, I do I do the contemplative meditation, I do the mantra meditation, I do the visual imagery meditation. What I do, I practice a relaxation asana called Sthiram Sukham Asanam. I practice a pranayama which is called the effortless breathing, exhalation longer than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. Then I enter into your pratyahara, controlling of 5 senses, beautiful way. I do a Brahmari pranayam. I just close all my 5 senses. I breathe out, take a deep breath in, breathing out. The vibration of the Brahmari pranayam has the same vibration of your brain. It cancels, it's called a harmonic resonance. I slowly enter into a dharana, the focus. I'm closing my mind. I'm doing some mantra, or I'm doing mantra, mind. And then slowly I enter into meditation. So for me, if you answer any kind of meditative practice, the whole practice of yoga, the end product is meditation. You don't practice meditation, meditation comes to you, and its final effect is all in body, mind, and spirit. And last, finally, take my words. This is a word you can engrave. It's called meditation is medication. At the level of meditation, our brain produces every medication you are taking from outside. And if you put the two words side by side, there's only difference. Meditation has a T, medication has a C. T is for transformation, C is for called choice, or your, whatever you say, I don't know. So your choice. So meditation is a practice which comes to you to give you the effect of medication.
Thank you for giving that.
Thank you.
Especially for those who are new in our program, may not know that what he explained was a personal reflection of Ashtanga Yoga, how he perceives it and practices it in the moral principle, the yama niyamas, and then he enters the asana, sthiram sukham asanam. He mentioned the pranayama, which is effortless. Then he mentioned the pratyahara as he goes inside, inward looking, and then slowly gets into the dharana, dhyan, samadhi. Excellent. That was very beautiful. And the last question is from me, and this is the very last. We will not let you miss your upcoming program. Many of
No, I'm fine. It's in the home, There's I have to just go to next. Okay, you go ahead. Last question. Okay.
That's about the contraindication you gave about the painkillers. And when you take the painkillers, one shouldn't enter into your yoga asana. Can you explain that very simply for people who may not be from the Western terminal, who may not be doctors? Yeah.
I hear it all the time. First of all, if you take it to pain medication, then if you start doing a physical postures, you're going to hurt yourself, because pain, as I say, called pay attention. Pain comes, remember, the pain receptors are in the ligaments or in the muscles. People say my joint hurts, my cartilage broke down, my heart. Hey, the cartilage doesn't have any pain fiber. When the cartilage breaks down, our body does a splinting. It tightens up. It tightens up your ligaments, tightens up your muscles. That causes pain. Like back pain. Back pain doesn't come from herniated disc or from your spinal stenosis. Yeah, those are underlying cause, but it irritates the nerve and it causes the tightness of the muscle. So that's what I'm saying, that yogic relaxation is the most important practice. But question comes, what you're saying very important is, suppose a person is on a pain medication, or maybe they're opioid addict, overdosed. They're coming to you. So on that situation, what we do, we let them sit down in a chair like here. We let them do a very simple relaxation. This is called relaxation of your hand, Adhi Mudra. Or we'll do a simple relaxation of your shoulders, little relaxation. Or maybe very simple relaxation of the neck. But primarily, we include your pranayama and meditation. And slowly, as I said, when you develop the transformation, which we all have, we call from rogi to nirogi to yogi, slowly we incorporate the asana practice. The person who has a lot of pain medication on board, we request them not to do any physical asanas, especially crossing the limit. If they see people who are on a severe pain medication, they're not going to do anything. So I let them sit down in a chair. I said, go ahead, put your hand in the back, put your other hand in the back, and slowly twist your spine. That'll be good enough. But other person who doesn't have, and give you one example, Akshay, very interesting. We have a pain medication in the United States called Aleve or Advil, whatever, I forgot that. And they put an ad. The advertisement was, I'm a yoga teacher. I get aches and pains in my body. So I take 2 Advil, then I go ahead and teach yoga. And we raised cane for them. They had to withdraw that commercial from the television.
That's a very pertinent point, and I was thinking of the CLBP patients. There's a
Yes.
big group in Boston, the low back pain. We have to really be sure they're not taking painkillers and doing.
Exactly.
That's a very
Because
pertinent
you go to,
question. I'm sure this is being taken notice of by my colleagues, especially in our yoga group at PGI. Professor Babita works on that. She's an anesthesiologist. I will speak to her about this if she's not hearing.
please,
Yeah.
please
Thank
do.
you.
And then again, if you separate, suppose the chronic lower back pain, when they come and they're acute, we say you have a contraindication for the forward bend. You don't forward bend, but what happens when you do forward bend, supported forward bend? Like I'm here, I have a table. If I can bring my head down on a table, I can just support a forward bend and I can incorporate my breath. I have a profound level of relaxation on the paraspinal muscles. This is called a supported forward bend. Putting your head, any amount you can come down. In acute pain, you maybe come down up to here. Put it in a high table, put it there and relax. Please pass this word. Very, very important. Do not take pain medication and practice a physical asana postures in full stage. If you start with the very early stage, which is called arambha, then it's called a sthiti, called a visarjan, 3 stages of asanas.
Thank you. We will now say goodbye to you because you have to go and our program is really long enough, but we really enjoyed every moment of it. Thank you for joining us. We hope to reconnect again and being with the viewers once again. I will send you the link and I'm sure the viewers can look at your recording later on also. Those who could not join now. Thank you very much.
Okay.
Namaste. Namaste.
Namaste. Thank you. Bye-bye.
Bye-bye.
Bye-bye.